little bit about the Colorado Shines rating schedule. And last but not least, we have Dalia Milford from the ECLC, and she will be discussing the ECC rule waiver. So Erin, I'm going to go ahead and share my screen with you so you can get started.
Thanks, Monica. I think I'm echoing, so hold on. Hopefully that's better. Hi, everyone. I am actually talking about childcare rules, not laws. As most of you know, we have some amendments to our childcare general rules up for public comment through today. Just to give a very high-level overview, we are aligning our, I'm still echoing. Can you guys hear that? Monica, is that, can you turn me down?
I can hear you fine.
Okay. We're aligning a few things with statute. One is our religious exemption. We're trying to get back to kind of the core of what that statute was. So that's in this rule package. We also had to align some of our background check requirements with the federal CCDF background requirements. So that is also in this rule package. And then lastly, we are required by statute every year to assess our fee schedule for licensing. And we are required that that be methodological and fair assessment of those fees across all of our facility types. You will also probably notice if you've been in the rule package that we share that rule package with child welfare. And so the 24-hour facilities are also in there, and they also have a new fee schedule. But I am going to talk about the less than 24-hour fee schedule. And so Monica, let me see if you can see this.
Yeah, I can. Okay, I can see it now.
Can you see it now? Okay. So a couple of things. When we looked at the fees that existed, we noticed that small providers were paying more per child, essentially, than a large provider. And we wanted to try and address that with a change in our fee schedule. The other thing that we're required to do by statute is that we cannot exceed our costs. When we set these fees, we cannot essentially make a profit off of our licensing fees. And so we did a very in-depth analysis to determine if we only took the licensing specialist, the cost of the licensing specialist on the ground, so anyone who has a caseload carrying position, and assessed what that on average costs, because we know that some facilities are going to take more time, they're going to have more complaints or more need for technical assistance, and that will cost more time in terms of the specialist. But in general, you know, average, what would that look like? That's the slide you're seeing right now. So on average, our homes cost around $443 a year to be licensed. And again, this is on average. Small centers are around $701. And then a center with a licensed capacity of approximately 20 would be $701. And you can see how it goes all the way up. And a large center, which would be something like a camp, could cost the department as much as $32.40. And the reason we have to do this by statute, right? So we have to make sure that we're not exceeding our actual costs. These costs do not include my time, our child care administrator's time, our attorney general's time in adverse action cases, any of those kinds of things. So this is a very conservative estimate, and that's on purpose because we want to make sure it's as conservative as possible. Can everybody mute? Because I hear like a hairdryer in the background.
Thank you, Erin. So everyone should be muted. It's one of the presenters. Thank you.
One of us. So we have heard loud and clear through public comment so far that setting fees at $100 or more for a home provider is going to be a difficult situation for some of our home providers. This is a once-a-year fee, but we have determined that it probably was also, in terms of our percentage of increase, one of the bigger increases that these homes were going to experience, because they're currently paying $27 a year to the department to be licensed. And so Kathy Wagoner and I have proposed a fee somewhere between $65 and $75 per year, and that would be the third year. So if you're looking at the rule, you'll notice that we are ramping these fees up over 3 years. That's to give small businesses time to plan accordingly. And so these numbers that you're seeing kind of in the pink section are where they'll be in 2020, essentially. So do we have any questions so far? And I think I can see the chats.
If you have questions, go ahead and type them in the question box, and then Erin and I can read them out to you if you'd like.
Okay, perfect. Yeah, that'd be great.
Okay.
While we're waiting for questions to come in, oh, do you have one, Monica?
No, no questions so far.
Okay. I also want to let everybody know where do these costs go if they're not being paid for by fees. So the costs that are not covered by fees are essentially absorbed by our federal fund. And right now, the department is recovering 6% of its costs across the board. We are proposing by 2020 that we recover 18% of our costs through fees across the board. We believe strongly in licensed care. We want to support licensed care. And that is why we want to be able to spend a large proportion of these costs through our federal dollars. We are required through our federal grant to maintain health and safety requirements, and annual licensing, et cetera. And so we are perfectly justified in using our federal funds to help subsidize the cost of licensing for these businesses. But we decided that we have so many priorities, high priorities, including improving quality and providing additional direct services, that we needed to be able to start to offset, reduce the offset by a certain percentage. So essentially, we're going to go from using offsetting the cost of licensing from 94% to approximately 82%. So the vast majority of the costs are still going to be supplemented and subsidized by those federal funds. I think that's an important point, that this is something that the department feels strongly about. We're supporting it at a very high rate, but we just can't support it at the high rate that we have been in the past. The second thing is, we heard loud and clear from organizations that are high quality and have a commitment to serving children in high need populations and receive CCAP. So we heard that that's going to be much more difficult for them to absorb increases in fees because their population, it's something they can't pass on to their population. So in the new rule package, we've amended the language to include a discount for high quality providers, level 3 through 5, who take a minimum on average of 50% families receiving CCAP compared to their total enrollment. So that is to essentially give those high quality providers who have a commitment to a low income population or a high needs population the ability to get a 50% discount on their licensing fees. We also have been going around the state the last 2 weeks and meeting with multiple communities, mostly small rural communities. And in those communities, they often have one provider who takes the majority of their CCAP cases but they have a large licensed capacity, and so they can never reach a 50% threshold for their total enrollment because of the way, because the county itself never has that many cases. So in those smaller communities, we're also going to be putting in language for the discount if a provider holds more than 50% of the total CCAP slots for that county. And that's to address the smaller, those small communities where they may not have providers that would exceed 50% enrollment. So I will pause again and see if there's any questions with that.
We have one question, Erin, and it says, okay, to be clear, I'm understanding that, for example, the fee for small homes would reduce from $443 to $75 per year.
So small homes, just a regular home provider, was paying $27 currently, and over the 3 years, that will go up to $75. So it was never $443. The $443 is what it actually costs the department itself. Does that help clarify?
Yes, thank you.
Okay.
Does anyone else have any questions? Go ahead and type them in the question box, please.
Yeah, and maybe it's worth me reiterating that. What you see in the pink above the pink, that is the actual cost for for us to employ our licensing specialists. That is the only cost that's included in that. But it is not the cost we are passing on to the provider. Also in the rule, for the large centers, the rule now is a base fee plus $2 a child the first 2 years, and then $3 a child the third year. And that is to start to get to some sort of equity between a small center and a very large center. We're not going to get there this year. It's just too, it's still very, there's just a wide gap still between what providers are used to paying. But that way of setting it up basically assists us to start to build some equity between very small providers who used to be paying the same fee as a very large provider, or a similar fee to a large provider.
We don't have any more questions at this time.
No more questions. No more. Okay.
Oh, we got one more.
Go to the second. Oh, go ahead.
Is there any incentive in terms of reduction of licensing fee for communities where several programs take CCAP, but the county allocation does not cover enough kiddos for any one center to meet either the 50% of CCAP allocation or 50% of center enrollment?
So not at this time, and the reasoning behind that is that right now what we're trying to do is if you think about it, it's a symbolic reduction. It's a symbolic reduction in the fee. It's certainly not going to absorb the cost of that any provider absorbs when they accept CCAP. But what we were trying to do is really reward those that have a true commitment to serving that population. We were warned by several providers, high-quality providers, that they didn't want to see a token CCAP child taken in. And we also want to make sure that these children are being served in high quality. So I don't think that was part of the question, but I wanted to make sure that that's clear too. They have to be high quality. I think over time, as Colorado Shines matures and we have everybody rated, that's a possibility that we can lower the number of CCAP children enrolled that can receive a discount. We might even do a proportional discount over time, where if you're a level 3 through 5 and you accept 25% of your total enrollment as from families accepting CCAP, then maybe you get a 25% discount. The reason we didn't want to do that this time is that we've really focused our resources on, and you all know this, on facilities that serve a high number of children receiving CCAP, and making sure those facilities got rated. And then this last year, making sure that we rated facilities where they're the only one in a community. And so we want to kind of roll this out slowly and see how it goes. We always can go back to state board and say it went really well, and we want to expand that. We think it's a way for, it's an incentive for programs to take additional CCAP. So this is kind of our first, we're dipping our toe in the water in terms of discounts. We've never done a fee discount in the past. So we wanted to be somewhat conservative this first year, see how it goes. And then, you know, tweak as needed. Okay, I'm going to go to a second slide. We actually have more state data than this, but Brett pulled the slide together and he wanted to make sure we were doing apples to apples. So he basically only pulled fees from states that have a similar model to what we're proposing. In terms of a base fee with per child fees. But if you can look at the first figure 2, you can see where Colorado is in terms of its fee schedule. And this was based on the original proposal of up to 100. So with it being lower than that, we're still going to be the lowest out of those 4 states up on the slide. For context, we're also still going to be below states like Kansas. We're below states like Wisconsin. So we are still going to be on the lower end of the spectrum, particularly for our homes. When it comes to our centers, we are kind of in the middle to low range. You can see Arizona is kind of our high end. I think they're the highest in the country. They actually are charging $7,800 for some of their centers right now to be licensed. But we're still going to be kind of in line with the majority of the states that we were able to gather data from. We are on par or a little bit lower. We're on par or a little bit lower to states like Wisconsin with centers as well. Wisconsin has a per child fee as well, and theirs is really interesting. They only charge a base fee of around $35, but then they charge $16.94 per child. So that really gets to equity over time. For those small versus large centers, but if you kind of do the math, we're going to be still lower than a state like Wisconsin. Any questions on that research?
We do have a question. It says, what about our licensed district CPP programs that only accept 15 children, do not contract with CCAP due to only being 3 hours, but serve the community's highest need families and very limited school budgets?
They're still going to have to pay the regular fee. They are subsidized by the Colorado preschool program.
That's all the questions for now.
Okay. The department also did research on other license fees and types for other professionals throughout the state. And we are by far the lowest in terms of professional licensing. Dog groomers is a more expensive license, so especially if you're considering it compared to home providers. So we did look at that as well. We didn't want to look like, we didn't want to exceed other professional license types in the state, and we didn't want to be the anomaly like Arizona is in terms of fees across facility types in other states.
And when will the licensing fee increases discount rollout start?
So the entire rule package, including the discounts, will go into effect December 30th, so effectively the first of the year. And again, it'll be when their annual licensing fee is due, so it could be up to almost 2 years for some facilities, depending on when they pay their annual fee. And again, these are ratcheted up over time. So I believe that homes will go from $27 this year to $33 next year. So it's a fairly small increase the first year. And then I want to say it goes up to $55 the second year. So again, trying to give them some time to adjust to the increase in the annual fee. And kind of the new policies. And also, this is another question we've gotten in other forums. The $2 or $3 per child is based on licensed capacity, not enrollment. And so if a center has typically licensed itself for a capacity of 100 children, but never intends to have more than 80, it could lower its licensed capacity to 80 and not have to pay that additional $20 or $30 or $40 for that larger capacity license. At any point in time, they can change that capacity and update their application. But from a child care desert perspective, this is going to hopefully give us better data, because we right now use child care capacity as a way to see if there's available child care in communities. And we know that a lot of providers license themselves for more capacity than they ever intend to fill. And so that might actually give us some more accurate pictures in terms of which communities really do not have or have more of a desert than we thought they did.
No questions at this time.
Okay. All right. Well, Monica, I think I'll give the screen back to you.
Thank you so much. Next, we'll have Tina from Qualistar. And I'll take over the screen, Erin. That's okay. Thank you.
Okay, well, thank you everyone for having me. I appreciate it. We've been getting a lot of calls about, well, what do we do now that all the pilot and priority sites are through the mix? And we have a lot of providers calling in. So I know there's still some confusion around the timeline for a Colorado Shines rating, and when do I submit my application, and when does that mean I'm going to get to rate? And to make sure that programs are understanding the timeline, we want to go over the system and how it works, and the message that needs to be conveyed to providers to ensure they don't have any misconceptions about how this process works. So when we were working with those priority sites, we were able to manipulate the system to ensure that those identified providers were having their ratings in the months targeted by the council and by the Office of Early Childhood. And as long as those sites submitted their applications at least 60 days in advance of their expected rating window, we were able to move them up in the queue and ensure that they were rated in that designated month. Now that we've completed all of those sites, we're utilizing the system as it was designed to operate. That system works a lot more fluidly now, and we're not manipulating the system without a directive from the Office of Early Childhood. And you'll notice that the beginning statement in this timeline is a little different than timelines that you've seen in the past. You'll see that it says when programs are ready, they submit for their Colorado Shines rating. A lot of times it used to say the programs submit at least 60 days prior to the month they'd like to rate. And that's because we can't guarantee where they're going to fall once they submit their rating. Because the system, there are a number of things that impact where a program lands in the queue once they've submitted their application. The system is designed to give them a priority ranking, and that's determined by a couple of different pieces of information. Some of the information within their application is considered, as well as some external demographic information from the state. So, for example, the number of children receiving assistance, such as children who have IEPs, IFSPs, the number of CCAP children, those sorts of things that are in the provider's application impact their ranking. But there's also local demographics that include a variety of factors that are also considered. Don't ask me what those are. I can't explain all of those. They were built into the system. But it does allow for those programs with the higher need to move up in the queue faster than those programs who do not have that kind of priority ranking. So they do move up, and the rate at which they move up really depends on a number of different things. It depends on the number of other programs that are submitting. It also depends on how many of those programs are submitting are high needs programs. And it also depends on our capacity window. We only have the capacity to do up to 30 programs or 99 classrooms in a month. And so if we get large centers that are submitting that have lots of classrooms, we'll have fewer programs that we can take. Or if we have a lot of little 1- and 2-room classrooms, then we'll be able to take more programs. So it's really dependent on our capacity window as to how many are going to get in at any given time. So right now, depending on their priority status, they could rate in as little as 60 days, or they could rate 6 months from the time they submit their application. Now, I will tell you right now that over the summer, there's a big lull, and a lot of programs did not submit their applications. So we actually have room right now in November, December, and January for programs to get their applications in and rate. So if a program submits their application now, it's very likely that they're probably going to get to rate in November. So, but they would need to do it today because tomorrow is September the 1st. So again, remember it needs to be 60 days prior to their rating window. So now once they reach their capacity window, once they've gone to the top of the queue and they're in that group of programs that we can provide services for, they're going to get an automated email from the system informing them of when their rating month is. And the rating month is their rating window. They're going to get that 60 days prior. So right now, tomorrow is September the 1st. So tomorrow, the system is going to automatically send out emails to every program that is going to be rating in December. So programs that are rating in December are going to get their notification tomorrow. Let's see.
Tina, is that November or December?
No, December, because September 1st, the programs that are rating, oh, I'm sorry. Let's see. See, I can't even do this right. So September 1st, the programs that are rating in October are going to get the phone call from their rater. So you're right, November. So programs that are rating in November are going to get their notification tomorrow. Thank you for helping me with that. And so then 30 days prior to their window, or approximately 30 days prior to their window, they're going to get a call from their rating specialist. And they're going to get an orientation call. And that call, that person is going to be their main contact through their entire process. So during the orientation call, they go over a lot of different things. They go over how many classrooms do we have, what are the ages of the children in those classrooms, what are your blackout dates, and every program, of course, gets 5 blackout dates for their month. Now, they get 5 blackout dates per classroom, Most programs just tend to do 5 blackout dates and have all their classrooms apply to that. But if you have one classroom going on a field trip on a day different than everybody else, that could be a different blackout day for that classroom. So they just keep that in mind, that it's 5 per classroom, but most programs do 5 per month. So their rater is going to go over all that information with them. And then after the orientation call, they're going to get an orientation email, a follow-up email that outlines all the things that were discussed during the course of the orientation call. Now, if they have any adjustments to their application that need to be made in terms of staffing or classroom numbers, those are the kinds of things that need to happen right at that point. So the rater is going to have to unlock their application so that they can make those adjustments. And then the rater will relock the application and open their access to the documentation upload, and then prompt the system to send them their staff and family survey links. So it's really important when a rater tries to contact the director of a program and leaves a message, if they don't get a hold of them the first time, for the program to call them back as soon as possible, because we want them to have as much of their documentation upload and survey window as is absolutely possible. So during the rating window, we observe in the classrooms that are designated by the system. So 50% of each classroom, each aged classroom, is observed. So we have infant classrooms, toddler classrooms, and preschool classrooms. So if we have 2 infant rooms, of course, 1 is going to be observed. If we have 3 toddler classrooms, we're going to have to observe 2 of the toddler classrooms. And if we have 5 preschool classrooms, we'll be observing in 3 of those classrooms, because we have to do at least 50%. The system chooses those classrooms. The raters will only change a classroom at the last minute if there is no other option, because it does take some maneuvering within the system, and we have to engage the Office of Early Childhood to help us with changing the classroom that's been designated by the system. So that is not something that we do often. The other thing we need to do is we need to make sure that we determine which ERS tool is going to be used for a classroom. And those tricky classrooms are those 2.5 to 3.5-year-old rooms, because we could use either the ITERS tool or the ECHRS tool, depending on the majority of the ages in the classroom. Sometimes at the beginning of the year, if they're like a school year program, the beginning of the year, we're probably likely to use an ITERS tool, whereas if we go in the spring, it's very likely we'll be using the ECHRS tool. But those are the kinds of things that are determined during that orientation call. There's another misconception out there that we can't observe if the lead teacher's not there. And I want to make sure that everybody understands that classrooms are observed when at least 1 regularly assigned staff member is present in the room, and at least 50% of the children who are expected to attend are present. Now, we prefer that the lead teacher be there, and if we have another option of another classroom that's been chosen in the system to do that day, we will do that. We also prefer that there's at least 75% of the children present. But again, we can only do that, we can only switch classrooms if we have another classroom that's been designated by the system to change over to. So just please keep that in mind and make sure that providers are aware that while those are the expectations, or while those are the things that we prefer, the expectation is that as long as 1 regular staff member is there and 50% of the children you expect, not 50% of enrollment, because we all know a lot of programs over-enroll because they have children who only come a few days a week. So finally, we want to get to the rating window. The rating window closes at 5 o'clock on the last day of the month. So for example, today at 5 o'clock, those programs rating in August will no longer have access to submit any surveys, family or survey, and their documentation upload opportunity will end. So, and the extensions will only be granted when there are circumstances in which the data system has had an issue that impacts a program's access to the system. And we only do that if it is down, if the system is down for an extended period of time, and generally if it's down for an extended period of time towards the end of the rating window. If it goes down in the first month of that 2-month upload period, we generally don't make allowances for that because there's plenty of time to get that stuff in. Do we have any questions so far? I've gone over a lot of information. I haven't seen anything pop up on the question board yet, so. All right, so once the rating window closes, the program will receive, it takes us about a month to go through all their documentation, get the reports written, and get everything proofread and out the door. So on the last day of the month following their rating window, by 5 o'clock, their dashboard will be open for them to be able to see their results. And at that point, they have several different options. They have the option to accept their rating as it stands. They can request a consultation. They can do both. They can accept their rating and request a consultation. Just because they're happy with their rating doesn't mean that they don't have questions, and we want to make sure that we answer those. Or they can do absolutely nothing. Programs have until the end of the month following the release of their results to request and complete a consultation. If they wish to resubmit any documentation or appeal their rating, they must have a consultation. If they don't request their consultation and complete it by the end of the month, they will not have an opportunity for resubmission or appeal. Any program not accepting their rating and not requesting a consultation will have their rating automatically accepted by the system after the last day of the month when they receive their results. So for those programs that do choose a consultation, if they still wish to request a resubmission or appeal, they have to submit the appropriate form and follow the directions and timelines provided. The rating specialist will go over this with them during their consultation and will send their resubmission requests and appeal forms to them immediately after the consultation. If they want to resubmit, they just need to turn in the request for resubmission within 7 days of the consultation. They don't have to have all their documentation ready. They just need to submit the form, because there is the possibility that they may not be able to resubmit or allowed to resubmit. If their ERS scores are too low, they may not be able to resubmit. So they just need to request that they want to do that, and then our assessment data manager, Tracy Corner, will be in touch with them to go over all the deadlines and the guidelines and talk them through the process. For those programs that wish to appeal, they must submit their documentation with their appeal request, and they need to do that within 10 days of their consultation. The appeal committee meets generally on the second Wednesday of each month to review any submissions for appeal, and then all the responses to those appeals are sent electronically within 10 business days after that meeting. So just so everyone is aware, the appeal committee is made up of representatives from licensing, the licensing division of the Office of Early Childhood, the Colorado Shines Department of the Office of Early Childhood. We have a representative from the Colorado Department of Education. The Early Childhood Council Leadership Alliance has a representative on the council, or on the committee. There is an ERS specialist from Clayton Early Learning and a representative from Qualistar. So there are 6 members on that committee that meet to review appeals and make decisions about those. So just to kind of recap a little bit, excuse me, sorry about that. We want to ensure programs are prepared to rate when they submit their application. It's really important that they are ready to go when they hit that submit button, because it could really possibly be in as few as 60 days. So we don't want to say, oh, well, I'll be ready in 3 months and I'll hope that I don't come to the top of the queue by then. Because the current process does not allow for postponing. If a program passes on their selected rating window, they're going to be removed from the queue and asked to resubmit. And that's because the system just doesn't allow for postponing. We can't manually manipulate the system to allow for that to happen. I also want to make it clear that programs cannot reserve their rating window. They can't submit and then say, oh, well, I want to go in January. We can't hold their spot in January. However, I do want to preface that with all programs that have rated previously will have a spot held for them because they're in their second cycle, and we will not allow anyone to lose out on CCAP funding because they couldn't get into the schedule in time. Now, having said that, we still want to encourage those programs to submit at least 60 days prior to their window so that all of the automated emails and reminders and things can be sent out on time. Any questions so far about that? Okay. Please remember that there are question and answer sessions conducted each month on the third Friday at the Qualistar office. They can either come in person or they can call in. We send out those invitations to all the programs based on their rating window. So for example, the programs that are rating in September got an invitation to attend the August question and answer session, but they will also get an invitation to attend the September question and answer session, assuming that we haven't been to their program yet, or even if we have been to their program and they still have questions, they're certainly allowed to participate. So I want you to know that those programs get 2 invitations to get on with a Qualistar rater and a Qualistar document, one of our document data team, to ask questions about upload and indicators for documentation, as well as ERS questions. Now, we also provide a question and answer session time for the coaches at every single coach's quarterly meeting. So coaches can participate at that time. We generally send out with the invitation a request to send questions in ahead of time so that we can answer them for everybody while they're all there. Do we have a question? I think we have a question. Rebecca was asking. Yeah, Rebecca was asking whether or not coaches can be included in the Q&A sessions. We prefer that the Q&A sessions for the providers, for the invitation that they get, is just the providers, which is the reason why we're providing the coaching question and answer session at the coaches meetings. What we found was that when we had everybody together, both coaches and providers, the coaches were kind of monopolizing the question and answer session that was for the providers, and that's why we've kind of created a separate question and answer opportunity for the coaches during the quarterly meetings. Of course, anytime a coach has a question regarding the process, they're more than welcome to contact us and ask us questions. Are there any other questions about the timeline and how the system is working and expectations for programs as to when they can expect to rate once they've submitted? Remember, in February, we will be starting our second cycle with our programs that started in February of 15. So those programs that rated back in February of 15 will probably need to be submitting their applications here in the next month or month and a half. Okay. I think that's all that I have.
Doesn't look like we have any more questions.
Yeah, I don't think we have any more questions. I'm going to give you our contact. I was going to put Tracy and my contact information up there. Did you steal the control back away from me, Monica?
You want me to take control? Is that what you said, Tina?
I'm trying to get it, go to the next slide.
I'll take it. I'll take it.
Yeah, could you, because I've got Tracy's email address up there and my email address up there if there are any questions regarding any parts of the process. Tracy manages the data team that scores all of the documentation that comes in, and she's responsible for the resubmission timelines and procedures. And I can help with any ERS questions or appeal questions that happen to come in.
Tina, I think your screen froze, but we can send that out.
It must have, because I can't get it to go. Oh, there we go. Wait, there it was. Hang on. All right. So there is Tracy's email address and my email address, in case anyone is interested. I think we have the handout in the handouts, so those should both be available to everyone. And I don't see any more questions. Do we have any more, Monica?
We do not.
Okay. Then I am all set. Thank you so very much, everyone. And if you have any questions later, please feel free to get in touch with me.
Thanks so much, Tina. Next, we have Christina Moeller, the director of the ECLC. Christina, are you there? Okay, so we're actually going to have Dalia Milford from the ECLC go ahead with her presentation. Thank you for your patience, everyone.
All right. So unfortunately, I'm not sure what happened with Christina's phone there, that she wasn't able to give a quick introduction. She had presented on the waiver request earlier in this year in regards to governance waivers. And so what I'm just going to cover today is waivers in general. As you can see on the screen, per Colorado Revised Statute 26-6.5-1041, early childhood councils have the opportunity to submit a rule waiver request for a rule within CCR 2509, which is the Child Welfare Child Care Facilities Rule, that creates a barrier to the councils implementing an early childhood project. Although this has been here for quite some time, the ECLC hasn't received any waivers in quite a while. So we just wanted to make sure that you guys knew that this was available. But we also wanted to make sure that you understood what this is not. So this is not a waiver for individual programs requesting a rule waiver. There's a whole separate process for that. And then you cannot waive any state statutes. An example of what you can waive, for example, if the amount of space for a toddler in each facility is 45 square feet, so if a council is working to increase the number of toddler slots in their catchment area, but for example, rent is too high, the council can request a waiver to say only 40 feet, request only 40 square feet per child or per toddler. And this would apply to all programs within their catchment. So it is not for just a specific facility. This is for all programs and all facilities within a council area. Oh, fancy. All right, so here is just a general overview of the process. Again, Christina Muller had gone over this previously, but there has been a few changes made to it. So I'll go through that right now in more detail. In order to request a waiver, and I don't think that I said it already, but you do have the handouts. So if you want to see any of the documents that go along with that, that's in the handout section. So in order to request a waiver, you would fill out the application form, which you guys can look at in the handout, and then submit them to the ECLC staff. As soon as we get that, Christine or myself will notify you within 7 days. It's normally much faster than that. And we will quickly schedule a ECLC waiver review subcommittee meeting. And that's going to be scheduled in 28 days, where before it had been up to 6 weeks. So we are trying to streamline that a little bit. Once we have that request, we're going to share that with the Department of Human Services. And somebody there has 7 days to submit a written statement back to us after reviewing the request, just covering all implications, any recommendations. That form has also been updated. It requests a lot more detail from them on why. Let me back up for just a moment. So I'm going to go over through some of the changes. Like I said, there is the application that you'll have to fill out. One of the changes that was made to it is it just requests a lot more detail than the governance waiver requested. For example, if you were going to request space be reduced from the 45 square feet for accounts for a toddler to now to say 40 square feet, you have to give a reasoning for that. You can't just say finding rent facilities is too high. Give us examples of that and provide as much information as you can. And for the Department of Human Services, we're requesting the exact same thing as them. If they are either for it or against it, they need to give us as much information as possible. So once we have that written statement from them, we'll pass that back on to the council that's making the request. And then if for any reason there's a discrepancy between the waiver request and what the department is saying, then we will schedule a conference call. Before, we allotted 7 days wait time in case anybody wanted to request that, and now there is no wait time. We are going straight on to the next step in the process, unless it's mandatory, unless there's some sort of discrepancy and we feel we need to have one. All information will go on to the waiver review subcommittee. And so if there is that conference call, then any information that comes out of that will also be passed on to them. And for the waiver review subcommittee meeting, we very, very strongly ask that you and a CDHS representative attend. That way, in case the subcommittee has any questions. A couple people, there was about 4 waivers for the governance waivers that we had one of these meetings for. Not many people attended, so what we're saying is please, please, please attend. And then at the closest scheduled ECLC meeting, which they take place every other month, all of the information that came out of the waiver review subcommittee, whatever their recommendations are going to go to the ECLC. They'll get this information long before the meeting. That way they actually have time to review it. And once they're at the meeting, they can vote on it and make that decision. As you can see here, the ECC is responsible for providing the letter to any affected programs. So if your request is approved, it is your responsibility to notify any and everybody that will be affected by that. The decision is going to be recorded publicly through the ECLC meeting minutes, but then we'll also put that all on our website. And if you go to our website, which I put the link here, you'll see the past governance waivers that were requested have also been posted on there, so you can go through and see what the process and the determination was. So that was a lot thrown at you. Do you have any questions? No, there's no questions at this time. Okay. All right. All right, well then that's it for me.
Thanks so much, Dalia. Let's give you guys a few more seconds to post in the question box to see if anyone has anything.
And all of the documents, both the ones that are the handouts, but the past applications or requests are also posted on our website. So if you do want to go through any of the documents, they're all up there. That's my information. That's Christina's information. Feel free to contact us if you have questions.
All right, well, that concludes our first State TA Day webinar. Thank you so much for your participation. The recording will be posted on the ECLA support site. And please join us for the next State TA date, which is, we're looking that up. And if you have not received that calendar invite, I believe it came out from Karen and Bowden, just send us an email so we can make sure you're added to that calendar.
It's September 28th, 2017.
All right, September 28th, and we will talk to you guys then. Thank you so much.